Hello, my name is Yainia Ramilian and I am an LPN to BSc online track student at Indiana State University. PowerPoint presentation is intended to parents and legal guardians of school-age children. The population at risk is children in elementary school, and the topic is how to protect your children from the flu and flu. Learning objectives of this presentation are listed as follows. After completion of this PowerPoint presentation, parents or legal guardians of school-age children will be able to have a basic understanding of what flu is and how it spread, have a knowledge of what months and seasons considered flu season, identify the benefits of annual flu vaccination for their children and themselves, describe day-to-day flu preventative action to protect their children from the flu illness, describe signs and symptoms of the flu, identify signs and symptoms of the flu that warrants immediate medical attention, identify ways to care for their children in case of flu illness, and ways to protect other family members from catching the flu. Before we proceed, I would like to encourage you to take the pre-test that I provided the link at the bottom of this page, and also I provided a link for the summary for the brochure that summarize this presentation for your future reference. Let's proceed. What's the flu? The flu is a communicable disease that's highly contagious caused by influenza viruses. Generally, there are 4 types of influenza viruses designated as A, B, C, and D. Type A and B influenza viruses are responsible for human flu illness every flu season. Commonly, the flu seasons are fall and winter. Flu season starts in October, peak through December and February, and sometimes it can last until the end of May. Person-to-person transmission of the flu involves flu virus field droplets generated by the flu-infected person during coughing, talking, and sneezing, travel through the air and enter the nose and mouth of the uninfected person and causing infection. The flu may also be transmitted to an infected person through touching contaminated surface and touching the nose, mouth, or eyes. The flu virus may travel as far as 6 feet away. Children are among the most vulnerable population for serious complications from the flu. Not all people who contracted the flu become sick or develop complications. Most people who catch the flu have mild illness and recover without medical care or medication. Children under the age of 5 are at high risk of catching the flu and developing other complications that commonly need medical care. Children with chronic health problems are also at high risk for contracting the flu and developing complications. Fever, headaches, stuffy or runny nose, sore throat, body ache, tiredness, and chills are common symptoms of the flu. In addition, children might exhibit vomiting and diarrhea. Complications of the flu includes pneumonia, inflammation of the tissue, the heart, the brain, as well as sepsis, which leads to multi-organ failure and death. That is very serious complication. Ear infection and sinus infections are milder complications of the flu. The most effective way of protecting children from getting sick from the flu and developing complications is providing them with flu vaccination every flu season. It is recommended by Center for Disease Control and Prevention that everyone above the age of 6 months old should get flu shot every season. Flu vaccine prevent the flu itself, flu-related hospitalization, flu-related doctor visits, and missing school days for children as a result of the flu. Studies show that flu vaccine reduce the severity of illness from the flu and developing complications. One recent study showed that flu vaccine is related to significant reduction in children's risk of dying from complications of the flu. Another study showed that flu vaccination between the year 2010 and 2012 decreases children's admission to pediatric intensive care unit because of the flu illness and complication by 74%. Flu vaccines works by helping the body's defense system to produce antibodies that will recognize future invasion of the flu virus and weaken or destroy them. Although it's important to get flu shot every flu season, some people are not able to get the vaccine because of severe allergy reaction to the flu vaccine or its component in certain health conditions. Talk to your healthcare provider if your child has a history of allergic reaction to flu vaccine, has chronic or acute health problems, or taking any medication before having your child vaccinated. Babies younger than 6 months of age should not get flu vaccine. Center for Disease Control and Prevention, U.S. Food and Drug Administration, together with other organizations, work to ensure the safety of flu vaccine for you and your children every season. Soreness and swelling at the site of injection is the most common side effect of the flu vaccine. You cannot get a flu from the flu shot because the flu shot is made of deactivated or killed flu viruses. Some possible but rare side effects of nasal spray flu vaccine may include fever, muscle ache, wheezing, and vomiting in children. Side effects of flu vaccine are usually very mild and disappeared on their own. You, as a parent, are also highly encouraged to get yearly flu vaccination in order to protect your children and yourself from the flu. In addition to flu vaccination, there are ways to prevent the spread of the flu and protect your children from the flu. Educate your children proper hand hygiene. Teach your child how to use alcohol-based hand sanitizer when there is no immediate access to water and soap. Educate your children how to cough, sneeze using tissue or inside of their elbow. Remind children to discard used tissue in garbage immediately. Encourage your children not to touch their eyes, mouths, and nose before washing hands. Wipe or disinfect surface and toys in your house. Keep your child away from sick people and teach your children to avoid close contact with sick people. Here I present you with some measures to take if your child gets sick with the flu. If your child is less than 5 years of age or have chronic health problem and develop flu symptoms, call your healthcare provider immediately. This is important because the healthcare provider may want to start the child with antiviral drugs. Antiviral drugs are most effective when started as early as 2 days after infection. Antiviral drugs may hinder the development of flu-related complications, and also antiviral drugs may make symptoms of the flu less severe and shorter. You can only get antiviral drug if it's prescribed by your child doctor. The other thing to do is keep your child at home away from others to prevent the spreading of the flu. Children should rest at home and stay away from school and other public area for at least 24 hours after their fever starts to drop below 100 degrees Fahrenheit or 37.8 degrees Celsius without fever reducing medication. This is to prevent further spread of the flu. While at home, encourage your child to consume plenty of fluid and rest. That will help them recover from the flu and prevent dehydration. Try to keep your child with the flu isolated from other family members until getting better to prevent the spread of the flu to other family members. If it's possible, try to designate one person to care for the child with the flu. Obtain immediate medical care if you observe any of the following signs and symptoms of severe flu. The symptoms are fever that exceeds 104 degrees Fahrenheit, trouble breathing, chest pain, bluish discoloration of the lip and the face, pulling ribs when breathing, severe muscle pain, signs of dehydration like dry mouth, no urine output in 8 hours, and no tears when crying. Child not alert and oriented or interacting when awake, and if you also observe seizure-like activity. All the information in this presentation are retrieved from the CDC website in the Virginia Department of Health. Um, at this point, I'm gonna encourage you to take the post-taste. It's the same question as the pre-taste, but it is good to take just to evaluate how much you learn. Thank you for listening.